Hello, I'm Stephanie Eade. I'm the Senior Manager of Partner Marketing at Appian, and today we're going to be discussing the new Appian AppMarket Accelerators, designed for the healthcare industry by Bits and Glass. Joining me today is David Hauser, who is the Appian Practice Leader at Bits and Glass, and Fritz Haimberger, who is the Vice President of Appian's Healthcare Practice. Thank you for joining me. So why don't you tell me a little bit about yourselves. David, you want to go first?
Sure. My organization's been working with Appian since 2009, so we're not at the beginning of the Appian story, but we've been working with Appian for almost a decade at this point. And at this point, we're finding the market is really looking to Appian and other providers for solutions that they can use right out of the box, and that's kind of where this whole app market thing fits in for us.
Terrific.
Yeah,
Fritz?
absolutely. Well, good morning. Thanks for having me. Yeah, working with the Bits and Glass team has been a real pleasure over the last 3 years, I guess it's been now. We've kind of had an extra push on the healthcare front, and Bits and Glass has been kind enough and generous enough to build up a team, have an expertise in-house, and also work with us here at Appian to kind of meld those two teams together. And as such, we have come up with these accelerators to actually get in there and provide kind of a running head start for our clients as we get in there and find a use case, be able to have something not necessarily pre-built, but to have more of an organization of how things should look, how things should run, as kind of a stepping stone to getting that then customization of the client up and off and running.
So we've talked a little bit about the app market. Why don't you tell me a little bit about what the app market is and what an accelerator is?
Sure. Go ahead, David.
Okay. The app market, I think, is a great vehicle for customers that want to leverage the power of Appian but don't want to start at the very beginning. So there's a lot of use cases out there, specifically in healthcare, where many organizations could use the same solution, but they want to customize it a bit. And to Fritz's earlier point, this gives us kind of a running start. So really what we're looking at is a core functionality that can be built upon and customized by an organization so that they can make it their own. They can kind of pepper their secret sauce in, if you will, but they don't have to start from the very beginning. So we want to use that strategy with the clients out there to really drive time to value in a shorter window.
Yeah, I would even go so far as to say it's almost a risk reduction effort as well.
Yeah.
It takes some of that pressure off the client. It allows them to know that what's already been built has been vetted by industry experts, folks that have been in the field, folks that have a clinical background or a clinical, a hospital finance background, perhaps that already have a baseline for what needs to be done, and then, as I said before, can kind of put their own flavor on top of it.
Terrific. So let's talk about the new apps on the app market.
Sounds good. Yeah, it was I was going to say a dark and stormy night, but it was it was a few years back where David and I started discussing the potential for building some of these applications, kind of pre-building, looking at what we might be able to do from an accelerator perspective. And we started talking about what are those real hot apps, things that are really resonating with our clients, both on the payer side of the house as well as on the provider side of the market as well.
Yeah.
And the four that we had come up with, we'd come up with one on the payer side, Utilization Management, and then we'd come up with three on the provider side, Clinical Trials Intake, Home Health Automation, Home Health Management, and then on top of that, kind of a patient-physician care portal, a way for physicians and their patients to better interact, to better manage the care, and hence came Manage My Care.
All right. David, is there anything else you'd like to add before we wrap up today?
No, I'm so thankful that we have this partnership with Fritz and with Appian in the healthcare space. When I look at industries that really could use some help in terms of modernizing, I think healthcare is top of mind, and I think there's a lot we can do here to benefit patients and health, internationally.
Sure sounds that way.
Absolutely, yeah. As we see both, especially U.S. markets, but certainly worldwide markets, starting to think about this shift. The shift from a fee-for-service model, from a very much a you do something, you get paid for it. You do something, you get paid for it. The shift moving more towards a value-based model of pay for performance. Really having that patient's best interests and ensuring that clinical gold standard of care is adhered to is of utmost importance. And to be able to modernize technology, to automate technology, to better enable those clinicians to make the best decisions possible is really the name of the game here. And I just can't thank Bits and Glass enough for investing the time and the energy and the people to get this done. Very exciting times ahead.
So let's talk a little bit about the Manage My Care app.
Certainly. Manage My Care was actually our original foray into the accelerator space. So it actually grew out of some work we did for an industry event where they had a hackathon. And we worked with a local renal agency and basically worked through different use cases.
Yeah, absolutely. So the initial thought of this was the quintessential being able to utilize Appian to really have that speed and power effect. The hackathon to which Dave has referred was originally an 8-week hackathon. We worked with this renal agency up in Canada and kind of got the specs, got everything we needed to get done, and started building within Appian. And week 1 was finished, week 2 was almost finished, and we'd completed the work. So it was very much a sit here, twiddle our thumbs, what do we do for the next 6 weeks? So it was an opportunity for us to be able to go back to that potential client and say, hey, what additional functionality would you like to have? So ultimately, this is where Manage My Care began to be built out, and we looked into this patient physician interaction, messaging, being able to have tiered levels of messages based on the criticality of a patient's presentation. So perhaps, hey, I'm on this new medication, my appetite hasn't been what it has been for the last few months. I'd love to come in and see the nurse, see the physician to talk about it. Or perhaps, hey, I'm having heart palpitations, this is a critical issue. I need to see somebody immediately, or perhaps I need to have an ambulance called, perhaps this is an emergent event. In addition to that type of messaging, we were able to also actually interact with the national level kind of healthcare IT repository to pass information back and forth from a population health perspective, from an aggregate perspective, such that they are aware of local health trends in that chronic disease space, specifically in this case, the renal, the kidney space.
Yeah. I think our intent initially was with renal, but when you get into it, it really supports all types of chronic care, right?
Fantastic.
So folks in a cardiac space,
Neurospace,
on and on. So the
any type of chronic disease management
Yeah.
can absolutely be applied from the Manage My Care application, to increase that transparency,
Yeah.
I think, between clinician and patient, to enhance the safety,
Yeah.
Even such extended functionality as getting into IoT devices.
Yeah.
So, BITS has made a big push in hooking up IoT to this particular application. We've got some Bluetooth blood pressure monitors, I believe.
Yeah.
Some other Bluetooth devices that can link in and, from the patient's home, wherever he or she happens to be able to upload that data directly to the clinicians without having to have them come in for an office visit.
Wow, that's fantastic.
Yeah.
So tell us about the new Appian Clinical Trial Intake Accelerator.
Okay, so we had done other work in clinical trial space before with Appian. This application accelerator is actually focused on initiating, planning, and starting a clinical trial.
Yeah, absolutely. So, the various phases of a clinical trials process. Appian, of course, has had a great bit of success in the pharmaceutical, life sciences, medical device space with clinical trials. It was kind of a natural segue for us to take it into the healthcare provider world and say, hey, we've done it and done it very well from the sponsor side of the house.
Right.
What if we take a look at it from the folks who are actually doing the trials? So what those sites are, who those folks are, who those institutions are, with which and with whom those sponsors do business to get their trials done. So, we kind of looked at it from what's the first step in the process? Well, a lot of time it's that study startup, it's the intake process, it is those sponsors looking to find appropriate sites to perform their trials. So it was a natural kind of segue for us to be able to say, we want our clients to be a site of choice, if you will, for those sponsors. So to have those sponsors know that, hey, if I go to this particular sponsor, to this particular clinical institution, they have their stuff together. They're going to be able to get us on board quickly. They're going to be able to get this paperwork through legal in an efficient manner. They're going to be able to very efficiently find a patient population, that would be appropriate to perform this clinical trial with. We're going to get all those T's crossed and I's dotted such that that trial can get green-lighted and get started as quickly as possible, ultimately saving, hopefully, the lives of as many patients as possible.
in terms of like lifting something like a trial off the ground, you know, it's not about one or two activities. It's really a huge orchestration of different resources and different people. So what we're trying to help the industry with here is really doing that in a way that is effective, that, you know, we're, as Fritz pointed out, able to initiate trials, but in a way that's really robust, right? A way that satisfies legal governance requirements, and ultimately patient safety is number one concern. So.
Yeah. Keeping that gold standard clinical quality of care at the forefront is absolutely something that we want to, you know, hold in the highest esteem. But by the same token, we can't, you know, disavow knowledge of the fact that it still takes dollars, it still takes a cash flow to make these trials happen. And we want to ensure that the sponsors, you know, are able to control that flow appropriately to pay folks when needed, that invoicing is appropriately happening as needed. But even on the front end, as we look to get a trial started up, for example, you know, looking at the financial feasibility of you know, starting a trial, getting it up off the ground, all of those different things, making sure that a principal investigator is, you know, in place and has accepted the terms of the agreement, ensuring that the IRB is squared up and that all of those I's are dotted, T's are crossed, those T's and C's are completed, ensuring that, you know, before that money is sunk to get a trial off the ground, that it will indeed be spent appropriately and in good earnest. You know, certainly looking at a lot of these organizations with whom sponsors work, nonprofit organizations, not-for-profit organizations, cash flow is of utmost importance to them. There's not exactly money to burn on trials that may end up in failure or never get up off the ground in the first place.
Can you talk about the new Home Healthcare Manager Accelerator?
Certainly, yeah. I think you know, Home Health Manager to me is one of the more exciting accelerators that we've worked on together.
Absolutely.
To date, yeah. There's a huge trend in the industry and globally to keep patients and to keep people in their homes longer, right? And try to bring the care to the patient.
Right.
And I think what we've done is a really great kind of first step in that. To that end, we've created an application where the back office for a home health care management organization can create a day trip agenda for each of the nurses that are out in the field, and, you know, based on their expertise, assign them to different patients and help them manage their trip even from a Google Maps perspective, if you will, so they know where to go first, second, and third. At the same time, the folks in the back office are able to review progress, and if things get bumpy in terms of, you know, certain visits are taking longer than they should or certain patients cancel, reroute nurses so that their time can be used effectively throughout the day.
Yeah, absolutely. That's great stuff, David. You know, the impetus for this initial, you know, discussion around the Home Health Manager app was because we were just speaking with so many clients and prospects that had very antiquated ways about going after home health. You know, obviously, with, as Dave mentioned, the big push in home health right now, we have an aging generation. The baby boomer generation is increasingly being hospitalized. And, you know, the question becomes, can we provide that same gold standard clinical quality of care to those patients in their homes? Perhaps alleviating a hospital visit, perhaps, you know, keeping them healthier by being in a place of familiarity to them. So, you know, to be able to utilize a technology like Appian to alleviate a lot of the software and kind of hardware woes that are currently in place from what seems like a 20 or even 30-year-old you know, process of systems. You know, it's not uncommon for us to hear about the electronic medical record that is used in the hospital, but perhaps the home health group uses a separate one or uses paper. Not uncommon for some of these clients to use old school GPS routing software to actually map out their patient flow for the day, as opposed to dynamic routing with Google Maps, say using traffic, utilizing, you know, if there's an accident on the main artery, be able to dynamically reroute that nurse around such that, you know, he or she can get to that patient more quickly and keep on a schedule. You know, some of this really neat functionality that kind of takes it to the next level. You know, things like nurse reporting. So say you've got a clinician out in the field, perhaps is responding to a you know, a thrice weekly visit to a certain house, Monday, Wednesday, Friday schedule, but perhaps this is a home that has a a history of domestic violence, or there has been some type of issue there in the past, that kind of thing can be red flagged, such that the nurse manager, whoever happens to be monitoring all of those folks out in the field, can keep a close watch, can keep an eye on that particular clinician that may be going into a not necessarily hostile environment, but perhaps an environment that is a little less than savory. Even providing such things as a dedicated emergency button, kind of a panic button within the app for that clinician out there. That's not so obvious. It's kind of like a bank's silent alarm. There's a button that's built into the app that says, hey, I've got an issue, but it looks like just any other button as that clinician would be charting. So anybody around would not know the difference, but it would send an emergency message back to kind of that central command saying, we have a clinician who's in trouble, please send help.
That sounds like a lot of great features with incredible benefits.
Yeah, there are.
Yeah.
The automation aspect of this really is just taking what has been that antiquated process and using antiquated systems to the next level to really take advantage of all of that inherent functionality of the device even.
Yeah.
Say you have a clinician out in the field who wants to validate that he or she has shown up at a particular patient's house. Perhaps this is a patient who is hard of hearing, has not heard the doorbell the last few weeks that the clinician has shown up, and in fact has been calling back to the home office saying, my nurse never came. But to be able to use, for example, GPS, geolocation from a device, being able to take a picture of a home that's then geotagged and time-stamped and say, well, I'm sorry, Mr. Smith, actually your nurse was there. He was there at 9:59 this morning. Being able to provide that kind of a backup, if you will, from a billing perspective, that kind of backup from a patient satisfaction perspective, perhaps just instead of having the argument of, I'm telling you they were there, to be able to actually prove, hey, they were there, but certainly not to be argumentative about it, but just say, hey, perhaps in the next few weeks, remember, she will be there at 10 a.m. on the dot. Please make sure you're listening for the doorbell. That kind of repetition, that kind of wrapping the arms around the patient, giving them that warm, fuzzy hug, making sure that they are well taken care of, or really kind of ups the ante on that standard of care.
Terrific.
Yeah, I think the big win with Appian is that the platform is mobile first. So this app really leverages mobile capabilities. We're sending nurses out into the field with iPads, and like Fritz said, we're getting all that functionality out of the iPad in terms of the camera, the microphone, GPS, capture. So we're really looking at taking that whole industry and kind of moving it into current day technology, right? Where right now there are a lot of people with clipboards or a spreadsheet on a laptop, right? And that's not really effective.
For the provider or the patient.
Exactly.
Well, and absolutely from a patient safety perspective, it really kind of raises that eyebrow of, could we be doing this better? Being able to utilize Appian's offline mobile capability to perhaps pull that data down, just before walking into the home, such that it's fresh, it's updated, and as that patient is then perhaps in a home that may have thicker walls or is in a rural area, may not have that real-time connectivity to be able to get back to whatever the EMR system might be, but to be able to kind of get that latest and greatest snapshot just before interacting with the patient. Obviously, it's a huge patient safety issue right there. Being able to have up-to-date medications, be able to have up-to-date contraindications on those medications. Perhaps that patient has just been prescribed a new drug regimen, such that it does contraindicate to a few other meds that were supposed to be dispensed while that nurse was in the home. Being able to say, hey, I can no longer give this, these two drugs are going to have a bad interaction. We need to perhaps go back to the physician and get some new orders, take a look at what the true medication regimen for this patient is prior to doing any further administration is really a patient safety increase, it's a patient satisfaction increase, it's a win-win all around.
Yeah.
Let's discuss the new Utilization Management and Review Accelerator for payers.
Great. I can start, Fritz.
Please, absolutely.
Yeah, so on the payer side, there's a big need to really ensure that the right care is given at the right time, and that's really the focus of this application.
Absolutely. So from a payer perspective, payers are constantly striving to strike that balance between ensuring that that highest level, gold standard clinical quality of care is provided to their members, while also kind of contrasting that with a money-saving bent. Obviously, it is in their best interests to save as much cash as possible from having to be paid out the door, but they want to ensure, as I said, that enough is being paid out to ensure that standard of care is being provided. That said, to be able to take a look at a patient from a holistic perspective, be able to take a look at that patient from what do they truly need, from a primary care perspective, from a specialist perspective, whether they are in their primary care physician's office, whether they may be hospitalized for an acute stay, for a situation that may have arisen emergently perhaps, or post-surgery. Being able to take a look at the different folks to whom that particular patient needs to be referred from a specialty perspective, to get those referrals, those authorizations taken care of, to ensure that the most appropriate clinicians are taking care of that patient at the most appropriate time, is really where Appian and Bits and Glass, utilization management and review accelerator comes into play.
Yeah.
Looking to automate that kind of decision tree flow of information, rather than force the manual workflow of a clinician sitting down, ticking and tying all of those different specialty pieces, all of those different referral pieces, being able to use Appian to automate a lot of those certainly high value tasks, but somewhat mundane and repetitive tasks that could then free up that clinician to do even higher value work, is really the key of what we're going for with this app.
Yeah, no, I totally agree. It's important if you think about it in the context of a clinic or emergent care environment. It's busy. There's a lot going on. They are very much multitasking between different patients that are coming in, different requests that are coming in from clinicians and physicians. And what we've tried to do is help them prioritize at some level, who to deal with first. That's really important in those types of environments as well. Try to remind the clinicians around what the organization's policy is for treatment of certain types of medical issues, right? In the heat of the moment, a lot of clinicians are really torn to get the best care to the person they're dealing with right now and move on to the queue and get to the next person. But part of what we're trying to provide in this functionality is a way for them to be reminded during the process that, hey, this is kind of the guardrails of what we recommend as an organization. And that way, we can hopefully, again, align the resources that are available to the patients.
Absolutely. One of the key things, at least in US-based healthcare, we have what's known as an observation status, right? So say you show up at an emergency room, at an emergency department, you present with a certain situation, you are, they've got a few differential diagnoses of what your issue may be, but perhaps they want to hold you for a little bit of observation. We have what's called 23-hour OBS, 23-hour observation status. So we're not going to truly admit you yet, but we do want to keep you here for a little bit just so we can keep a watchful eye on you and make sure that your situation improves, or to further or better diagnose whatever malady happens to be happening, right then and there. Utilization review and management is a lot of times used, as Dave mentioned, as those guardrails to ensure that, hey, from a billing perspective, we know that if this patient is in-house longer than 24 hours, he or she needs to be admitted. That needs to be an admitted inpatient. So a lot of times you see that patient rolling right around that 22, 23, 24-hour mark, a lot of times using those case managers within the hospital, along with those case managers that may be on the payer side of the house as well. It's in their best interest to ensure that this patient is getting that top tier care possible. So making sure that those guardrails are in place for all of the different folks that have that vested patient best interest at heart, all working together towards that same positive end game. That's really the key here.
All right. You can find out more about this accelerator and more on the Appian AppMarket.